when their sugars spike, they only come into this area, they stay down in this area, they stay in this area, or in this area, and then maybe come back up or into a normal in that area. Again, a liver that cannot then allow the blood sugar to come up high enough would be an underactive, hypofunctioning liver. Okay? A pancreas, though, that suppresses the sugar just by that amount of a spike is a hyper-overactive pancreas. Okay? And then we see the adrenals that can't respond, they're underactive, hypofunctioning. Okay? And then when we look at the gonads again, after that period, if they're pushing the sugars down too much, hyperactive. Okay? The thyroid that's bringing it back into range, if we're actually here, would be pushing it down too hard. That would be hyperactive as well. And then the last two would be hypo and hypo as well, if they push the sugars too low. Okay? The interesting thing about this is, again, each organ has a responsibility. Let's talk about that and what that mechanism is for just a moment. Of course, when we look here, we're actually measuring the blood sugar based off of a post-fast. So first morning sugar means our adrenal glands should have been working during the night, maintain our blood sugar in this range. If our adrenals were too underactive during the night, our blood sugar would be low. If we're hyperglycemic, then the adrenals may be very, very insufficient or overactive, but in this case may even include something of the liver's inability to work. Liver actually increases blood sugar by its release of glycogen stores. So we look at glycogen stores being released, but also as the blood sugar increases and stays high, then we also see that this liver's ability to release or function may be impaired by its inability to recognize the sugars that are in the bloodstream and therefore keep them high as well. Okay? One of the biggest markers that we usually look for of liver dysregulation are cholesterol elevation as well as triglyceride elevation. Remember that? We talked about that several times, where our cholesterol greater than 200 with our triglycerides greater than 1/2 our total cholesterol may be an indication of an imbalance in the liver or an imbalance in the thyroid. Okay? How does the pancreas work? Pancreas releases insulin. So if we release too little insulin, our blood sugar stays high. If we release too much insulin, we have an overactive pancreas. Okay? So reactive hypoglycemia is very, very common, where we eat something of a high sugar meal and within an hour we feel like we're getting the nods. Okay? Because that pancreas is so overactive, it pushes us into a hypoglycemic state. Okay? These people are at greatest risk of becoming diabetics because they're pushing their pancreas so hard that it's overproducing insulin and it ends up burning out those cells and they become diabetics later on. Okay? And often insulin-dependent diabetics. When we look at the adrenals, we've talked many, many times about adrenal activity this year. Okay? The adrenals overactive actually produce excessive amounts of cortisol during fasting states, but also glucocorticoids that actually stimulate glucose activation and utilization from the cells. So the adrenals actually overproduce, or if they're too underactive, may then keep that suppressed. Okay? When we look at the gonads, testosterone and estrogen actually have a responsibility in our blood sugar balance, but mostly in that is testosterone, primarily in both bodies. Okay? Remember, our bodies both male and female have testosterone. Our bodies, both male and female, have estrogen. Okay? It's just which is more dominant in the system. What becomes more dominant in the system in the male who's going through andropause? Estrogen. Okay? Which is more dominant in the young woman who's dealing with something called polycystic ovarian syndrome, or PCOS? Testosterone. Okay? And that creates more insulin resistance. So an overactive testosterone production in a female creates insulin resistance, which then maintains that blood sugar elevation, and that creates this blood sugar imbalance, which can lead to infertility as well. Thyroid, when we look at thyroid, an underactive thyroid will keep the cells from becoming metabolically active, therefore unable to burn off the sugar, so consequently the blood sugar stays high and the sugar never gets into the cells. Okay? So that's where then the body starts to recycle the insulin with the circulating sugar and converts it to the fats, bringing up the cholesterol, triglycerides in our serum counts. Okay? So that's the relationship of the thyroid to that blood sugar as well. Thymus and spleen, really when we look at, thymus has more to do with our immune system, and the spleen also has to do with the immune system as well. It's interesting to observe many times people who are diabetic will actually have white blood cell counts that are greater than 11, when the normal range should be somewhere between 5 and 7. They'll actually allow the white blood cell count to become elevated to maintain blood sugar function. Okay? So there's several things that we see as potential barriers to optimizing function. And white blood cell count elevation may not only be an indication of infection. It may actually be the body's attempt to bring down those circulating sugars before they become sugar alcohols or toxins to the system. Okay? How many of you have heard of something called the diabetic neuropathy? Familiar with neuropathy? Neuro refers to the nerves, and pathy or pathology has to do with some type of disease process. And often in this case has to do with nerve pain, okay? Particularly in the lower extremities or the small vessels. What happens is when the body is circulating the insulin with the blood sugar, that sugar is converted into a sugar alcohol, and in those small blood vessels where we're trying to perfuse the tissue, say out in the toes for example, we start to see that the small vessels now have a toxin in them. Instead of delivering something healthy, they're actually delivering a sugar alcohol, and that becomes very neurotoxic to the nerves and the cells in that periphery. So we see delayed wound healing, sensory deficits, and pain, and that's usually what we'll see with the neuropathy. Okay? So again, elevations of white blood cells may occur in an attempt to bring down those sugars before it becomes a sugar alcohol. The other thing we'll see often are the yeast infections. So a lot of times people with elevated sugars will have a very strong yeast smell to them. They'll have rashes in their armpits very commonly, on the trunk and the abdomen and in the groin. And those often can be little telltale warning signs that the blood sugars are staying high or being elevated. Okay? Isn't it interesting though, most of us when we think of blood sugar, we've always been told pancreas, right? But look how complicated or complex that system is over just that 6-hour window. Very fascinating. Does anybody have a question? That's more of just a fact lesson tonight, but I think it's fun facts to know. Any questions there? Okay.